All right, well, welcome. Thank you for joining us. Today we have our final budget bill that makes up our Republican House budget for the state of Minnesota for the next 2 years. We have that bill on the floor today. It's our HHS bill, and I'll turn it over to Chair Matt Dean to introduce that bill, and then we can take some questions.
Thanks, Mr. Speaker. Today we will have the Health and Human Services Omnibus bill. This is our bill that provides all of our state health funding, also social services. It spends just a little bit over $14 billion in state funds and about $19 billion in federal funds. We're funding our priorities within the means that we have. We're focusing on the people at most risk and with most need, the disabled, the elderly, and those folks who need the most help. We're also providing for their caregivers within this bill and trying to do so in a Minnesota way that really focuses on the needs of the patient and the person, whether they are in the dawn, the twilight, or the shadows of life. That's who we focus on in the Health and Human Services Committee. We have a lot of difficult choices to make within Health and Human Services because there's nothing really that we do that's not a good thing. So it's a choice between things that you want to do, and you have to make priority decisions. We've got really good people within the state of Minnesota that do that care for people, and we're very proud of the work that they do. We do have savings within the bill of about $600 million that we achieve through reforms. So when you don't do across-the-board cuts, which is what the governor said he doesn't want, is across-the-board cuts, he wants reform, it makes it difficult to measure what those reforms are going to bring in terms of costs. So we do back up those reforms with other cuts, but it's about $600 million, and then we have about an additional $80 million or so in additional funding within the bill. So that's what the bill spends. What it focuses on, and we'll turn it over to Chair Schomacker to talk a little bit more about the areas within his committee, which is the policy and reform.
Well, good afternoon, and thank you. We had a really great opportunity this year to really put some focus on some needed areas within the areas of health and human services, and Chair Dean talked about the overarching and what we were doing there. We'll be able to pass this bill off the floor today with a 7% increase to our home and community-based services. Our bill allows for that to happen, and we're really excited for that. The numbers really are needed in that area, and so that 7% is really going to be helpful for them. That was one of the focuses that we had this year. Chair Kiel and Chair Franson will talk a little bit more about the focuses in those areas, but we tried to focus in on the child care area. We tried to focus on long-term care, particularly with our elderly, keeping up with our investments there, and also in mental health, trying to expand the availability of beds and get more people into the workforce there so that we have greater access for that and take some of the stress off the industry and off the state for what we're doing there, and we're really excited for that. And so next I will introduce Chair Kiel to talk about some of the reforms that we had in the areas of aging and long-term care.
Thank you, Chair Schomacker. Thank you all for being here. We on the subcommittee of aging and long-term care, we worked on many provisions that were authored and vetted in the committee, and then also traveled on to the policy committee. Some of the things we did were nursing facility education scholarships, so we're helping nurses as they come out of college or as they have sought a job, and they have to commit a little bit of time, 10 hours, to dedication to nursing homes and aging facilities. Also with home care providers too, so that is a high need in our district or in our area, and Minnesota is really going to be needing a lot of senior care. Also, we reinstated the Alzheimer's disease working group to do some research and also to help families to deal with and learn how to handle their family members who either have dementia or Alzheimer's, helping them to be able to stay home longer. I think with some techniques you can have your seniors, family members that are suffering from those kinds of diseases exist longer, and that's a better, healthy way for them to be They seem to be more successful in life when they can be in a comfortable setting, so we want them to be at home as long as possible. Something else that we worked on was senior care workforce. Workforce is a big challenge in rural Minnesota as well as the metro area, and senior care is very challenging to get enough help, enough nurses to work in that area, and very important. But we have an innovation grant program for senior care workforce, so I'm looking forward to seeing that work. And then also, as Representative Schomacker, Chair Schomacker suggested, he had a bill on value-based reimbursement reform that we heard in aging that did a little bit more reform for our nursing homes. And we have, it's been 30 years since we updated nursing home care in 2015. And we're seeing a lot of good results from what is happening within the nursing homes. And we strengthened some of the areas that needed to have some help. So I thank you, and I will introduce Representative Franson.
Thank you, everybody. I'm so excited to let you know a little bit about what has been happening in childcare. I'm Mary Franson. I represent District 8B, the northeastern part of Douglas County, and the eastern half of Otter Tail County. I also serve as chair on the subcommittee on childcare access and affordability. We have a lot of bipartisan measures in Chair Dean's bill. Our policies will help address the access and affordability by improving relationships between the counties and DHS and child care providers. Ultimately, we are working to stop and reverse the family child care provider shortage in our state, which has been deemed a quiet crisis by many. Most of our family providers, more family providers will mean more access to quality child care.
Take some questions.
Question for Chair Franson. Does your bill include a CCAP increase?
We do have some money for CCAP, which will address like $10 million, which will help bring in about 600 more families into the CCAP program. $14 million.
Is there a cost of living or a pay increase for the personal care attendants in the bill? And what level?
Yeah, so it's one of those interesting things that it's not in the bill because it didn't have to be in the bill. There was an automatic inflationary increase that was coming in July of this year, and so it was already baked into the forecast there. We were given direction by MMB that they wanted to have more clarification because they were trying to interpret after the fact that this inflation was already paid for in advance with the 5% campaign that was done a few years ago, and another couple percent increases that we've seen over the last couple of years. And so Governor Dayton put it in his supplemental budget to turn that back and take away that 7% increase. We actually don't have to say anything about it, and the personal care attendants and those that are on waivered services are able to receive a 7% increase July 1st of this year.
This may be a question for Chairman Dean, I think. Governor says the bill does not account for Medicaid inflation, and he asks which seniors are we going to take off Medicaid as a result of this bill?
Sure. The governor disagrees with automatically baking in inflation into our budgets. And, you know, what we're saying is that if our spending in this area is going up over $2 billion, we're serving Minnesotans. Within those increases, we understand that we have to get a control over the cost increases. If we automatically bake that into the forecast and into our budgets, we have to spend it in the way that it's been prescribed. If we get that money and we can spend it on the same people in a Minnesota way and a better way, wouldn't that make more sense? If you could save that money, pull it out of the automatic inflation escalators, balloons that we've all become accustomed to in dealing with, particularly with federal policy, what if we could decide in Minnesota how to spend that money on seniors? and deploy it in a way that made more sense other than just baking everything into an automatic formula escalator. So we think we can do things a little bit smarter with that by pulling it out. Also point to the last deficit that we had, which was a $6 billion deficit that included automatic inflators that happened to be wrong. So that we just got that wrong. So we made automatic cuts, real cuts to higher ed and to other areas that we ended up not needing. So that our inflationary increases are abrupt, they're unpredictable in terms of whether or not they're right, and we think that we would be able to spend the money in a way that made more sense if we were able to do that within our own budget.
Another thing the governor says is that the repeal of MNsure is not wise, given the uncertainty at the federal level. Who knows what Minnesotans will have to work with there. It'll be a lot more difficult to get those services through the mass federal exchange as opposed to something here.
Right, and the governor and MMB predicted that MNsure would have over 600,000 people on individual policies. That turned out not to be the case. Obviously, we were incredibly off on that. It has not worked out well for the majority of folks. And this isn't about putting people on a federal anything. It's about separating people who are on public programs from people who want to buy private health insurance the way they used to, and to get an incentive to do that and go out and buy it. This just cuts them loose from having to deal with the government and a broken website unless they're on a public program. That's all it does.
Not just the governor, but even some Senate Republicans have criticized some of the cuts and savings in your budget. The Senate Republicans the other week suggesting that some of them were more speculative and weren't backed up by fiscal notes. So I was wondering what your thoughts were on that.
Well, when you try to save money through reform, it's going to be tougher to measure. But I would just ask our friends to look back and to join the administration and look backwards. When we said that competitive bidding was a good idea, and they said it was a bad idea, and there was be no money to be saved. And then in their next budget, they were touting the successes of competitive bidding and all of the money that they saved. And actually, the budget director said that that was the #1 reform that they had in state government that they had rolled out. So when you are trying to reform things, you're always going to have pushback, and you're going to be trying to do things better and save money. And we really believe that the money is there. I would point out that MMB currently says we're paying $50 million for people who don't qualify for health care, and that's from their spreadsheet and their prediction that we're currently paying for 17,000 people who don't qualify for health care. But they haven't gotten around to checking yet, but that's on their spreadsheet. So that's not my $50 million, that's their $50 million.
When this question of eligibility to determine verification came up 2 years ago, you guys talked a lot about Illinois and Pennsylvania and the experience they had. And those states ultimately ended up saving some money, but it took a couple of years to get started in those states. But you're baking in savings right away in this upcoming biennium. Do you think it's realistic to save that much money that quickly?
Yeah, if you look at, we've got several eligibility determination savings that we're looking at. Representative Drazkowski's reintroduced his bill. We backed off of the savings on that one. We've also got another provision called I'm Not a Robot, which reaches out to everybody who's on a public plan and says, you know, check a box, I'm not a robot, I live in Minnesota, I qualify for these plans, please get back to us. Because we're sending automatic payments to the HMOs every single month, whether they hear from this person or not. And if you belong to a gym like I do, and you don't show up like I don't, you're the favorite customer because they get a check every month or an automatic withdrawal, but they don't have to see you every day. So we want to make sure that we're paying for the people who only qualify for programs, not somebody who lives in another state, who doesn't qualify, or who is dead.
How are those notices delivered? Are they by mail, by phone, by email? What's the?
Well, we currently have within CGIP a thing that's mailed out to employees of the state that says, hey, get back to us, check this box. It's actually a box you check and send back. And if they don't hear from you, they can follow up and they can find your address and they can get a hold of you. But it's just some affirmative way to certify that you're qualified and you live in Minnesota.
It's not just a one-check deal, like if it gets lost in your mail, or, I mean, if there, is there multiple checkpoints to make sure you're not shut off the state program just because you didn't get back?
Well, that's something HMOs probably will have difficulty with because it will be up to them. We're withholding 2% until you find the person. And if you don't hear from them or you can't find that they're a person in the system, then they're disenrolled. So there's an incentive on the HMOs to make sure that people who are on the programs qualify, live in the state, and are alive.
Are there any policy provisions in this bill dealing with abortion?
There's one provision that was put in later in the Ways and Means Committee that's less controversial. The Department of Health is okay with it. It's a minor provision. It's less controversial. The provisions, there are two major provisions that are being carried on the floor separately this year that have in the past been carried in the omnibus bill. So those will be carried separately on the floor. One is no taxpayer funded for abortion. That is not in the bill. The other one is licensing for abortion facilities. That is also being carried separately on the floor.
On the no taxpayer funded abortions, I think you're the author and the speaker's co-author. Do we expect to see that after the break?
Mr. Speaker, I'd like to, if we can, take
Are
this.
we done with HHS stuff?
I have one more.
Let's finish that first.
Is there a cash increase for the MFIP recipients?
There is a provision in by Representative Pearson that you'll hear on the floor, and it is not the requested amount, but we can follow up with you on that to show you exactly what it does. Anything else? Thanks, everybody.
Thank you.
Thank you. Mr. Speaker, and Leader, the Governor said, and I guess this is surprising, that during the break he's going to send you folks a letter detailing areas that are problematic in the bills. Frankly, he had a long list. He says, pre-K, I'll hold out till the very end. Buffers, don't mess with the current law. Enbridge, absolutely unacceptable. Metro Transit, we've got a problem there. Minneapolis LGA, don't mess with that. State agencies across the board cuts are not acceptable, need to be explicit. HHS, he's got problems as were detailed earlier. A question we have out of this, more broadly, is can you hope to get any signatures from him on this, on anything that you folks pop out of conference?
We hope to, and I understand that, he may not like every provision in every one of our bills as they go off of the House floor. We understand that, but that's what conference committee is for, and we hope to engage the governor in the conference committee process, work out the differences, and send bills to the governor's desk that he can sign. I think he needs to understand what we're doing. We're actually putting more money into pre-K than the governor is. We're just doing it in a different way. And we think it provides much more flexibility to the school districts to provide those services that may be different in each school district. So, we think it's important to allow the district some flexibility in how they spend those dollars. We prefer a targeted approach using scholarships as opposed to a blanket kind of one-size-fits-all approach that the governor has used. So we actually are leaving the dollars that have been in pre-K. We're allowing those schools to use them by cutting some strings and use them with a little more flexibility, but still on kids, those younger learners. So, that provision should not be objectionable from the governor. We're actually giving school districts more flexibility. He should wrap his arms around that provision. But, if we have to talk about these and, help him understand that we're actually doing a better job of helping kids and teaching kids and really targeting it at the kids that need it the most, we're happy to have those conversations with the governor.
And I don't want to steal every issue here because I know folks have other questions, but Enbridge, the amendment that was put on yesterday, he was adamant about that, said absolutely unacceptable.
Was he also adamant that he supports the line, the pipeline?
Well,
Because I've heard that before too.
I didn't ask him that
Yeah,
question.
we put that provision in the bill because we haven't believed the words that the governor used in the past. And I don't think Minnesotans believe those words either. When he says he supports Sandpiper Pipeline, he did not. He killed Sandpiper Pipeline. And what Minnesotans lost was 2,000 jobs, and we lost millions of dollars of permanent, ongoing tax revenue for local government. So when he says he doesn't want a reduction in LGA for the city of Minneapolis, is he just as concerned about the 20% that he cost Crow Wing County in local property tax revenue by killing Sandpiper Pipeline? I hope he is, because that's the reality. And what we have here is an environmentalist vendetta against what they see as stopping fossil fuels from being used. In reality, I hope to never see one of those Democrats' cars pull up to a gas pump, because the reality is that Minnesotans rely on that. And we can do it safely, we can do it clean, and we can take advantage of those natural resources, and we can transport it in a way that's good for our economy, but also safe. And that's what our bill does. And you know what? We don't like hearing now that there's a second or third delay in the environmental process for the replacement of, I think it's called Line 3. That has been mandated by the federal government that line needs to be replaced. It's also something that will create a large number of jobs. It's a $2 billion investment. It's literally the most moving thing I heard on the floor about it, if people care about bonding bills in greater Minnesota. It's 2 bonding bills worth of private investment in the state of Minnesota. I don't know how many jobs that is for that particular line, but for the Sandpiper Pipeline, it was 2,000 jobs that the state of Minnesota lost because Governor Dayton blocked that. And the line didn't stop. It just simply went around the state of Minnesota, and our surrounding states benefited from that, and they got the jobs. So, we don't trust when the governor says he supports that, and we don't like hearing that the Public Utilities Commission is continually delaying these things. And it seems convenient to us that they're delaying it until May 15th, which corresponds nicely with the end of our legislative session when we all go home and turn into a pumpkin. So we want to take action and make sure that Minnesotans' voices are heard now during the legislative session, because we don't want to lose that property tax revenue. Just like the governor doesn't want to lose LGA for Minneapolis, we don't want to lose that property tax revenue for all of those communities along the line that could use it. And we certainly don't want to lose the jobs that we know Minnesotans want and need.
Can I just add something to that too? And the other moving point I felt from listening to the testimony was this is a pipeline that's very old and deteriorating. And so if we are concerned about the environment, we need to make sure that we're replacing it so that we don't have problems going forward. So as the speaker said, we have to do this according to the federal government. So it really kind of ties our hands for the governor to say that we shouldn't be doing this. We have to do it. It could be a lot worse if we don't.
I'll also add, I'm not in my backyard kind of guy. I think it's the largest pipeline in the state of Minnesota, runs right through the middle of my district. And I often say that, and I believe, maybe I'm even underestimating, but my guess is 90% of the people that live in my district have no idea it's even there. So we do support it, and we felt by putting that provision in the bill that we were going to show Minnesotans that we were with them in supporting this.
Mr. Speaker, that word trust you use, is there a trust gap as this moves into the next phase of the session here?
Not necessarily. The governor apparently commented in his press conference that we had a good lunch last week, and we did. And I personally like the governor. If he wants to hear me say nice things about him, you certainly can ask, and I'll be happy to tell you all of the nice things I like about him and why I like him. But I don't think he has the best ideas all the time. And frankly, I think Minnesotans deserve a debate on these issues. I think his arguments and our arguments together hopefully will come to a consensus that actually is better than either one of ours. And that's what we should aim and strive to do. So while I like the governor very much, I don't necessarily think his ideas are the best for Minnesota, and I'm willing to advocate for the ideas that my caucus is bringing forward, because we think our ideas are better.
Mr. Speaker, are you watching the other body work, which obviously they're much slimmer majority and they're less ability to pass maybe what the Republican caucus would prefer. Are you sometimes frustrated watching the more moderate cuts, more moderate budget, less pure budgets coming out of the Senate side?
That's an interesting question. and I will resist the answer that you probably wanted me to give. No, I'm not. It's not, and I have very much respect for both sides of the aisle in the other chamber. But we have work to do in our chamber, and we have to balance the not only the personalities but the ideas and the vision of the members in the House, and that's what we're doing in representing in the bills that we're putting forward. Now, we might have a little different perspective coming from the minority the last time into the majority now in the Senate. They didn't always live through what we did the last 2 years, and I think we still believe that the governor should have signed the tax bill last year, and obviously our tax relief target to help out Minnesotans is a little bit bigger than theirs, and that's probably why. We just really believe that we need to make up for lost time. And Minnesotans haven't gotten a chance to share in that prosperity. So that's why our bills might look a little different than theirs. Somebody wants to ask about Real ID, I'm certain. Did the governor talk about it?
I really do, but.
Nobody's writing about it?
I asked too many questions already.
I'll take it if you have it.
Nobody else? Okay. Well, do you think he's willing to bend on this? He didn't answer the question about whether in fact this would be a must-have for him to have the codification, not on the bill.
It was really good to hear the governor say that he does not believe his administration can change the undocumented immigrant driver's licenses through rulemaking. I don't know that I necessarily agree with him, but that is his point. So we have a bill that deals with Real ID and making sure that Minnesotans, we get that enacted so Minnesotans can use their licenses next year to get on a plane. Obviously, the governor feels that he can't change that through rulemaking. So we can just if he believes they can't, we can certainly change our language to make sure that our bill reflects what he believes to be true, and we can send that to him. And that should wrap this issue completely up. There should be no further disagreement. It doesn't have to be a prohibitive thing, but just say that that he can't change that through rulemaking. That's fine with us. We're willing to live with that. We just don't believe those two issues should be attached. We want them to be dealt with separately, and we believe that the legislature, and apparently he does too, he said it again today, that the legislature should weigh in if there's a change made to illegal immigrant driver's licenses, and we believe that to be true. But right now we want to deal with the Real ID issue, make sure we get that taken care of so people can have the peace of mind that they can use their license to get on a plane. So we can take what he believes to be true, we can put that language in our bill, and we can send it to him. We should be able to have this done by the week we get back from break. It should be very easy if we all agree on the same thing.
But what will Senator Box's ask be?
I don't. I wish I knew. The one thing that I do know is there will be an ask. If Senator Bach is involved, there will be an ask. I don't know what it will be, however. But you can ask him that question.
Something on the Iron Range.
So, anything else?
What will you be doing for your break?
I'm going to spend a little time traveling around the state, talking to Minnesotans about our budget and what their priorities are, and get feedback from them on where we're at. And I don't think I'm really taking any time off. But hopefully I'll get a couple of days to spend with my dogs. Joyce, what are you up to?
I'll be probably going around the state meeting with some people as well, and my kids are in school, so no break for me. Yeah.
Yeah.
Well, I'm sure
We'll be
we'll be
working.
working, we'll be
Yeah.
meeting.
Sounds good. Thank you all.